41, Edith Bradley for Western Carolina University. I have with me this afternoon to Dr. Eric Byrd from Hendersonville. He is a doctorate in medicine in the University of Missouri, and also he had internal medicine residency in the University of Kentucky. And also Dr. Byrd like to do missionary trips to Latin America and Haiti. Good afternoon, Dr. Byrd. How are you today?
Just fine, thank you.
Now, how long do you have this clinic to the service of the Hendersonville?
I've been here for 25 years.
25 years.
Mm-hmm.
And then you have a specific program for diabetes, right? For the community, like on the website, they said diabetes management.
I manage a lot of diabetes. It's not really a community program,
Oh,
but
it's for everybody.
I take care of
patients.
Yeah.
Okay.
All my patients with diabetes, I manage them.
Okay. And can you tell me what is the most common challenge you see managing diabetes for adults and over 64 years old?
Sure. So my average age in my patients is 80.
Wow.
So I basically do only geriatric diabetes. Yeah, I mean, I don't know what the studies say, but I can tell you what I see.
Yeah.
I guess that's why you're asking me. Let's see, in no particular order. Probably, probably the number one thing I would say would be the collection of medical problems they get otherwise, comorbidities. If they have comorbidities, that gets in the way. If they have orthopedic issues and can't exercise, loss of muscle mass with aging, sarcopenia.
Sarcopenia.
I can list them. Do you want me to explain how each one works?
No, it's fine. Polypharmacy would be one of them.
Polypharmacy, definitely. That's that affects compliance. That ends up being economics sometimes. Economics is one.
Yeah, it's one of the big ones. Yeah.
Fancy new pills and shots.
Right.
Cost money.
Ozempic.
Kidney dysfunction. That gets in the way of certain meds you can use. That's probably I guess a big one would be cognitive decline.
Cognitive decline
as they age.
Okay. And then what factors contribute most to poor glycemic control in geriatric population?
Oh, well, all the above.
All the above.
Yeah. So any of those factors, I don't know most. Probably, multiple medical problems, comorbidities. If something's going on with some other, they get a malignancy, then their efforts at their diabetes goes down because they're doing chemotherapy or something like this. The cognitive dysfunction, if they, get confused.
Just to highlight this, last year, my sister and I, we went to this like a community service in Peru, helping those elderly, disabled, orphans in the very pure part of Peru. And we noticed something when in Peru, every Christmas they do like a little chocolate meal with some kind of breads in there. But we noticed something when we went to get the groceries in the market. The Peruvians put a labels like add sugar, really high labels that nobody can miss those labels. And it's something that we notice here in America. When you go to buy something in the market, some people, they don't know pretty much reading the labels. Are you agree with it? Like they might need, especially diabetic people, portion, size, calories. What do you recommend for all those people, the elderly especially, they have some vision problems, some kind of maybe cognitive problems?
Sure.
What would you recommend to the community, especially for people with diabetes?
You mean as far as dietary things with like how to navigate all of that?
Like reading labels, buying groceries,
Sure.
Calories, carbohydrates, protein, sugar.
Yeah. I talk to a lot of people about that. Obviously, a big misconception, which I think is not respective of age,
Mhm.
but people see low sugar or sugar
Mhm.
free, but they don't look at the carbohydrates.
Exactly.
So it's a carb is a carb is a carb. It doesn't matter if it's a simple sugar or a complex carb, by and large, for glycemic control. Um, so I talk to them about that all the time. With the smartphone, which most everybody has, almost regardless of economic strata, the smartphone has made that a little bit easier. Um, Here's my phrase: if God made it, ask Google. How many carbs in an apple? You know, 25. And if we made it, look at the label.
I'm agree with
Most
you.
of my people don't have problems reading labels, but they might not know how. But then once they learn, I don't know if they.
Yeah, it's very interesting. In July 17, Governor Senator Sanders, I think Congressman, I'm sorry that he proposed this bill to the Congress about those big labels that I was talking them through, and I think that would be a wonderful idea. Bring this to, especially for the community, for people, for children, disabled, for everybody to be aware what you're buying in the market. What do you have in your hand, even if you don't know much about calories, carbohydrates, and that's just a big sign. This has a lot of sugar. One other question: what evidence-based strategies have been most successful in improving diabetes self-management in the county?
Sure. I mean, I'm not sure about that, like the recent data,
Hmm.
but as far as what I do in my clinic, engagement with me, accountability, following up with, do this and check labs so that they can see. The CGMs, yeah,
CGMs,
that's made a big
the
difference.
the new one, the Lingo
Um,
one. That's
mhm,
kind of those devices that call Lingo that
mhm,
you stick on
mhm.
there.
Yeah, there's
Do
several.
you recommend those for some patients?
It depends. If I don't need them medically per se, if they're not on, a multi-shot insulin regimen, but they're nice.
And
If I if
expensive too.
uh, They can be expensive. The over-the-counter one that you can buy for 2 weeks is not bad. So I've used that many times. If I know they're not listening to me,
Mhm.
or I say, get a monitor, look at what you eat, look at your sugar, and then that tells that that I've seen that help a lot of people. I could tell you some stories. That just shows them in real time, you know. But that's not accessible to everybody. So
No, Medicare doesn't cover really the fully, but there's
yeah, so you have to do that.
certain,
Like
programs that.
for self pay, I only do that if I need to show them what they're not picking up. You know, like the bagel has 50 carbs.
Oh yeah,
This is what it does to your
and that's
glucose.
good.
You know, the but otherwise, I don't know. I mean, I educate them on the end organ effects as far as that goes. Um, Now, geriatrics is a big term. If you're 80s and have complex medical problems, then the importance of your diabetes, in all the data drops. Not that you totally disregard it. Sometimes you do, but typically not. Um, di-
Dr. Bird, just to finish this interview, if you could create one new community program in Henderson County to improve diabetes care for older adults, what it would be and why?
oh wow, a community program. I'm not an expert on that stuff because
Something that
I do like contextual,
something to
planning.
maybe recommend to
Yeah.
somebody start like a blood sugar checks,
Hmm.
or
Sure.
I'm very stick with the labels. I found in this project that a lot of people don't know how to read carbohydrates, and they're really something that we like to go to the community and say, hey,
Hmm.
we do this, like there's some programs.
Sure.
um,
That all sounds good. Uh, yeah, I'm not sure. Like on a community level, some people need to see it one to one. So if they could wear a glucose monitor for a week,
Individual.
that would be nice. Um, some people need they don't quite get the whole. Okay, so what do I eat?
Right.
Now